All right, so you probably heard a little earlier this evening here on SA Tonight that the Health Department has made a plan with Treasury for unplaced junior doctors. Let's speak now to Dr Tshepile Tlali of the Junior Doctors Association of South Africa. Doctor, thank you so much for joining us. So you can confirm from your side, has everyone been sorted?
Sally, and hi to the viewers. So yes, all the South African doctors have been placed.
What about the non-South African doctors?
Unfortunately, they haven't been placed yet again.
But I thought it was mostly foreign-trained doctors and foreign doctors who were left out in the cold.
Yes, so there was I think about 40% of the affected doctors in the media cycle were South African trained. Then the remainder of the 288 were foreign trained, but it's still South African. Then we still have the foreign nationals that reside in South Africa and are not permanent residents who are still without jobs.
Okay, so talk to me the numbers. Talk me through the numbers. Because the numbers have been shifting. I think there were still 200 who needed a place. So are you saying not all those 200 have been placed?
Well, all the 200 all the 288 that were being discussed, let's say those who are deemed eligible for placement by the ICSP, which are South Africans, either studied in South Africa or studied abroad, those have been placed.
Okay, so that at least is very good news for that group of people. When you say the foreign doctors, how many are we talking who do not have a place?
The number it shifts. There's a lot. I cannot give an accurate number. We have been in and out of contact with quite a number of foreign nationals who have been looking for internship and community service placements, and some of them have been waiting for periods of 5 years to get placed. And they cannot practice in South Africa until they've gone through the internship and community service.
I mean, are we talking are we talking a couple of hundred or more?
I think the number is around there. I'd say it's a bit between 100 and 200. Yeah.
So why the reluctance to place the foreigners when we have Cuban doctors here, for example, and that doesn't seem to be difficult to sort out?
So it's all a matter of funding, because there's limited funding for internship and community service. The ICSP has come up with a tiering system which kind of gives priority to who's going to be placed first. So the South African doctors who are trained in South Africa will have first priority, then followed by South African doctors who have trained abroad, and lastly for foreign nationals. And unfortunately, foreign nationals just fall by the wayside all the time.
Even though we desperately need those skills in our hospitals right now. I mean, I've been speaking to doctors and professors who are telling me this evening that we have probably just about peaked here in Gauteng, but we're going to have at least 2 to 3 more weeks of intense pressure on our hospitals. Do you think that this problem, though, that's been solved, at least for the initial group that we're talking about, I have been told by Victor Kanyele of the Health Department that it's solved the problem for the coming years as well. Are you able to tell me if that's true or not? Have you been able to assess it?
I'll speak honestly about this. I am not confident that the problem has been solved for the years to come. I hope it's the truth, because it'll make our job less strenuous. We've been dealing with this for many years now, and we've heard a lot of promises, and we've heard things. We've heard about new funds being created to allow for statutory posts to be funded separately, and yet there hasn't been a difference. It just seems to be getting worse. So I really hope that this situation, this problem has been solved.
Yeah, us too. Well, please do keep us informed, because this is something certainly that it seems a little bit of pressure and public pressure certainly helped to make the difference. So thank you very much for chatting to us, Dr Tshepile Tlali of the Junior Doctors Association of South Africa.